Chemotherapeutic drugs. Chemotherapeutic drugs are cytotoxic agents that inhibit or destroy the division or growth of malignant cells. They are used to treat cancer. A single drug or a combination of drugs may be given. These drugs can also be combined with other treatment methods such as radiation therapy or surgery. The drug or combination of drugs prescribed depends on the type of cancer being treated. Based on the chemical structure and mode of action, chemotherapeutic drugs are categorized into 4 classes, including alkylating agents, antimetabolites, plant alkaloids, and antitumor antibiotics. Alkylating agents were among the first anti-cancer drugs and are commonly used today. Alkylating agents act directly on DNA by cross-linking DNA strands, pairing DNA bases abnormally, or breaking DNA strands, thus preventing cell division. These effects are caused by adding alkyl groups to the electronegative groups of DNA. Alkylating agents are not specific to the cell cycle phase. They can act on cells in different and multiple phases of the cell cycle. Although these agents may be used for most types of cancer, they treat slow-growing cancers more effectively than rapidly growing cells. Antimetabolites replace naturally occurring building blocks of DNA molecules, such as purines and pyrimidines, and alter function of enzymes that are required for cell metabolism and protein synthesis. These drugs are cell cycle specific and are most effective during the S phase of cell division. Plant alkaloids are antitumor agents derived from plants. These agents block the ability of cancer cells to divide into 2 cells. Some of these drugs are cell cycle specific, which are more effective during the S and M phases of cell division. Antitumor antibiotics bind to DNA and prevent RNA synthesis, an essential step for protein production and cell survival. These drugs can uncoil the DNA strands and prevent the cell from reproducing. These antibiotics are not specific to cell cycle phase. As chemotherapeutic drugs target rapidly dividing cancer cells, they can also affect normal, healthy fast-growing cells. Damage to healthy cells causes side effects. Some of the common side effects of chemotherapeutic drugs are listed here. Chemotherapeutic drugs are cytotoxic agents that kill cancer cells. There are more than 100 different chemotherapy drugs. The drugs are categorized into 4 different classes, based on the chemical structure and mode of action. The right dose of the drugs must be prescribed. If not, it may cause severe side effects.